Well, hello. Welcome to yet another video series. This time we take our cameras and look at lifestyle medicine. Well, you may ask, what is lifestyle medicine? Well, the medical profession and the community has long recognized that many diseases of our current age are related to our lifestyle. And many doctors have taken a keen interest in this field, and they themselves have become practitioners. We have put together a series of presentations by one such lifestyle medicine practitioner, Dr. Peter Tung. Now, Dr. Peter Tung is a retired surgeon with a long interest in promoting healthy living and has conducted many public lectures on health topics. Now, since his retirement, Dr. Peter Tung has completed a course of study from the Australasian Society of Lifestyle Medicine, and he is now a practitioner. So I hope this series of presentation by Dr. Peter Tung will provide you with sufficient information to develop, to enhance a healthy lifestyle.
Remember last time we spoke about diabetes, and today we are talking about high blood pressure and how to control it using lifestyle means. Now, high blood pressure is a very common condition. In fact, it's thought to affect about 1/3 of adult Australians, which is much higher than the 5% that have type 2 diabetes. So let's just talk about high blood pressure for a moment. You see, the body needs to have a circulation. And in order for the blood to circulate around the body, it needs a certain amount of pressure to push it. The heart is the pump that provides the pressure. And in fact, we can measure the amount of pressure with blood pressure machines. And I'm sure that all of you have had the experience of having your blood pressure tested by a doctor or nurse. Now, the blood pressure is usually stated in two numbers, such as 120/80. Now, the 120 is called the systolic blood pressure, which means the pressure when the heart is actively pumping. The lower number is the pressure we call diastolic blood pressure, which is the pressure when the heart is resting in between heartbeats. Now, high blood pressure means that the blood pressure is higher than it needs to be. And when that happens, then the wall of the blood vessel can become damaged, can become stretched. And then fatty deposits of cholesterol can deposit in those damaged areas. And as the deposits build up, they can cause narrowing and restriction of the blood flow. And when that happens in places like the heart, it can give you a heart attack. When it occurs in the blood vessels of the brain, it can give you a stroke. And in the kidneys, that can cause kidney failure. So high blood pressure can also cause a strain on the heart itself, because the heart has to pump against greater force. And this can cause eventual failure of the heart. The heart's ability to pump blood becomes weaker. Further problems, instead of just having the blood vessels becoming narrowed by the deposits, sometimes the damage to the wall can cause the wall to become weak. And then the arteries, the blood vessels can swell up and stretch. And in fact, it can become in danger of bursting. So you can see that there are a lot of problems associated with high blood pressure. So it's important to try and treat it. Now, about 5 to 10% of cases of high blood pressure are actually caused by a hormone disorder or maybe a kidney disorder. And if you treat those disorders, then that fixes the blood pressure. But that means that in about 95% or more of blood pressure cases, the only way to treat it will be either drug treatment or better lifestyle change. So let's look at these lifestyle changes that we're talking about. The main lifestyle factors that affect blood pressure are listed here. So if you are a normal body weight, or if you have a low intake of salt in your diet, or if you exercise about 30 minutes a day, and if your alcohol consumption is low and you have a healthful diet, then the chances are that you will not have high blood pressure. In fact, a very large study of nurses looked at these risk factors, and they found that the most important risk factor was having a normal body weight, or and of lesser importance, but still significant, was a low usage of pain medications. If you exercise regularly, have a healthy diet, if you drink little alcohol, and if you have folic acid supplements, then your chances of having high blood pressure were very small, almost certain to have normal blood pressure. Now, folic acid is a vitamin that's found in green vegetables, so it's quite rare to have low levels. Next, let's look at some misinformation about high blood pressure. Many people think that high blood pressure happens when you're getting stressed and the weather is hot, or when your blood pressure is up, then you suffer from headache, dizziness, sweating. And these ideas are not correct. In fact, some people think that when they're prescribed blood pressure medication, if they don't have a headache and they don't have dizziness, then they don't need to take their medication. But that's incorrect. The only way to know whether your blood pressure is high is to measure it. Now, looking at the risk factors, there are some things that we can't control, such as if you have a family member who has high blood pressure, then you will also be at risk. People who are older have a higher risk than people who are younger. People who are male have a higher risk than female. And certain ethnic groups have a higher rate of blood pressure risk. So these factors you can't do much about, but there are plenty of factors that you can control. Now, being overweight, as you've said before, is the main factor that causes high blood pressure. When you're overweight, it forces your heart to work harder. If you are overweight, then you probably have a 3 times higher risk. And if you're in the level of what we call obesity, then it's even higher. Physical activity is also important. That reduces blood pressure, because when you are physically active, then the blood flow goes to your muscles, and which means that the blood has more space in which to travel, and so the pressure is lower. Smoking is simply a reaction to the nicotine which is in cigarette smoke, and that will constrict blood vessels and raise the blood pressure. We know that salt causes high blood pressure. We've known that for many, many years, and that's well documented and well known. But probably what's not so well known is that drinking too much alcohol can raise blood pressure. And of course, alcohol has many other bad effects besides that. Stress can cause an increase in stress hormones, which tend to have the side effect of raising your blood pressure. Now, here is a chart looking at how much your blood pressure can be lowered if you follow these lifestyle changes. For example, if you lose weight, you can drop your blood pressure by 5 to 20 units for every 10 kilograms lost. And similarly, for a healthy diet, low fat, low salt, exercising regularly, these can account for around about 10 millimeters of mercury drop in pressure if you follow these lifestyle changes. And then, of course, stopping alcohol or quitting smoking, these can also contribute a certain amount of lowering of your blood pressure. Now, you might think that, well, lowering your blood pressure just by a small amount doesn't have much effect, but really, this study shows that even if you reduce your blood pressure by the number 2, then you can really lower your risk of heart disease, heart attacks, and stroke by a significant amount. So let's go on to these factors. And the first one, of course, we're going to talk about diet. There is a diet called the DASH diet, which is simply DASH, Dietary Approaches to Stop Hypertension. When you look at it, this is a diet that's been worked out, which is high in grains and vegetables and fruit, lowish in dairy, and it's low fat, very small amounts of meat or fish, and a very low sugar intake. So this is just like any healthy plant-based diet. Notice that there's no mention about lowering your salt intake. And you find that when you follow this diet, your blood pressure can be lowered quite significantly. I'll go into the research a bit because this might help you to see how it all works. So in this study, which was conducted in 1997, there are about 450 odd subjects, and they divided them into 3 groups so they could examine people on a DASH diet, and they compared that with a group that ate the regular American diet. And the third group was the American diet plus extra fruits and vegetables. Well, they kept the groups on the diet for about 8 weeks. And at the end of the 8 weeks, they quite easily showed that the DASH diet group had the lowest, the greatest amount of lower blood pressure. In fact, those who had high blood pressure reduced their systolic blood pressure by 11, an average of 11. And that's about what most blood pressure medications can achieve. The American diet with extra fruit and vegetables also had a bit of lower blood pressure as well, but not as low as the one on the DASH diet. And as we said, they kept them on this diet for 8 weeks, but as early as 2 weeks, they could tell that there was already a difference. Now, going on to the effect of salt, you see, I said that in this diet, they hadn't reduced the amount of salt, but when they went ahead and added to the diet a reduction in salt, they compared the DASH diet with the regular American diet and 3 levels of salt intake each day. And of course, at the end of the 8 weeks, they could see that the lowest blood pressure were in those who had the DASH diet and the lowest amount of salt. So cutting down on salt will definitely reduce your blood pressure. Here are some tips on how you can do this. all packaged food has a food label, and the label by Australian law has to show the amount of sodium. And so you can always check the level of sodium in your food is. So we would recommend that, in fact, if you just have fresh or frozen vegetables, these, of course, won't have a food label, but you can be assured that they won't have any added salt. Processed meat and tinned foods will always have a fair bit of salt. You can avoid those. If you want to cook your rice or your pasta, do it without salt. And in fact, there are many other seasonings to use besides salt so that you can have a bit of taste, spices, herbs, lemon, lime, vinegar. These other seasonings don't have the bad effects of salt. Now remember, other things that cause high blood pressure is medications. And there's a whole list of medications that can raise your blood pressure. So it's a good idea to check with your doctor and find out if there are any of these medications that are prescribed that you can reduce or somehow leave out. Now, there's an interesting fact about certain dietary items that can raise blood pressure. Now, of course, you probably know about alcohol. We've already mentioned that. But actually, sugary drinks can also raise your blood pressure. And certain foods will actually lower blood pressure. We saw that people who had the regular American diet but had fruits and vegetables as well, they lowered their blood pressure a bit. Just check with your doctor, because these foods tend to be potassium rich, and if you have kidney disease, you might need to just watch that. Now, the interesting thing is that, believe it or not, chocolate lowers blood pressure, but I don't want you to feel as though you can go and eat all the chocolate you want, because I'll go into the evidence for this a little bit, because it's quite interesting. Scientists found that a certain tribe in the country of Panama, the Kuna Indians, they were virtually free of high blood pressure. And they eventually traced this to a certain drink. They drank a cocoa drink, which was made of seeds of the cacao plant. And they realized that this plant contains flavonols, which is a chemical, what we call a phytochemical, which actually lowers blood pressure. Now, of course, when you eat chocolate, that's derived from the cacao plant, but there's so much processing that the flavonols are lost. And so only certain types of chocolate are helpful. And we simply recommend dark chocolate with 70% or more of cocoa. And you can purchase these. These are likely to be effective in lowering blood pressure, but because chocolate is always made with fat and sugar, we want you to limit it to just 1 or 2 small squares of chocolate per day. So there's the good news for the day. Now, the next important factor is exercise. And we know that aerobic exercise will lower blood pressure while you're doing the exercise, and that effect will last for about almost 24 hours, which means that if you exercise regularly, then your blood pressure can stay low almost indefinitely. If you do resistance exercises, that is also helpful because it opens up blood vessels in your muscles. But please note that while you're doing the exercise, you can have a rise in your blood pressure. Now, we've mentioned this before, but it's worth mentioning it again. Alcohol is always associated with high blood pressure. There's no difference between the different types of alcohol, and so you're well advised to steer clear of alcohol if you have high blood pressure. Other factors are related to stress, and it's important to have regular sleep. Keeping up social contacts can reduce your stress. Being good with your management of time, using meditation and relaxation techniques are important. And then if you have certain things that stress you out, then you need to identify them and learn how to manage them. And these are things we may address in later talks. Now, when you use lifestyle change, how much can you lower your blood pressure? Well, if you combine the effects of diet, reducing salt, exercise, alcohol reduction, and weight reduction, you can lower your blood pressure by 14/7, which means that if you started off with, say, a blood pressure requiring treatment of 145/95, then by using lifestyle change, you can probably lower it to about 131/90 on 85 or 86. And that would mean that you'd probably be at a level where your doctor would say, well, you don't need any medication. So lifestyle change can certainly help you to reduce, if not eliminate your blood pressure medication, at least reduce the number of medications you're on. Now, finally, just a bit of a warning. We know that diabetes is common, and so is high blood pressure, but the combination of the two is actually worse than each alone. And you have a much higher risk of heart attack and stroke, kidney damage, eye damage. So it's very important to have good control of both conditions. And the good news really is that, as you remember from our talk last time, the same lifestyle changes can benefit both diabetes and blood pressure. And so I want to commend to you that lifestyle change is really good for these two conditions. And as we'll find later on, lifestyle change is really good for many other health conditions as well. Now, next time, we will be talking about exercise, and we'll go into the ways in which exercise can help you, and the recommended types of exercise. So I look forward to presenting that with you.